Hi, my name is Connor Toops, and my PSA is Molloscum Contagiosum. Molloscum Contagiosum is sometimes called water warts and is a viral infection of the skin and occasionally of the mucous membranes. Molloscum Contagiosum can affect any area of the skin, but is most common of the trunk of the body, arms, groin, or legs. The causes of Molloscum Contagiosum is an infection caused by a pox virus. The result of the infection is usually a benign, mild skin disease characterized by lesions or growths that may appear anywhere on the body. Within 6 to 12 months, molluscum contagiosum typically resolves without scarring, but may take as long as 4 years. The lesions known as mollusca are small rays, usually white, pink, or flesh-colored with a dimple or pit in the center. They usually have a pearly appearance and are smooth and firm. In most people, they range from the size of a pinhead to as large as a pencil eraser. They may become itchy, sore, red, or swollen. The transmissions for molluscum contagiosum may be sexually transmitted by skin-to-skin contact or lesions. Transmission through sexual contact is the most common form of transmission for adults. Also, molluscum contagiosum may be transmitted from inanimate objects such as a towel and clothing that come in contact with the lesions. Molloscum contagiosum has been transmitted from swimming pools and sharing baths with an infected person. To prevent molluscum contagiosum, you can wash your hands, avoid touching the bumps, don't share personal items, and or avoid sexual contact. In most cases, molluscum contagiosum doesn't need to be treated. The bumps usually go away on their own in 6 to 9 months. Doctors usually recommend treatment for those bumps in the genital area to prevent them from spreading. If you do need treatment, the choices are freezing the bumps, which is called cryosurgery, scraping off the bumps called curettage, putting a chemical on the bumps known as potassium hydrochloride, or using medicines of those that can treat warts. The symptoms of molluscum contagiosum are bumps that are round with a dimple in the center. The bumps don't cause pain. The bumps are usually small and are initially firm, dome-shaped, and flesh-colored. They usually become softer with time and have a central core of white, waxy material. These are the pictures of molluscum contagiosum. Molluscum contagiosum is very common across the United States and is found in 1% of all skin disorders. Molloscum contagiosum is most commonly found in kids under the age of 5. The average annual rate of outpatient visits was 20.15 out of 10,000 persons. Children 1 to 4 years old had the highest incident of 77.12%, which was twice that of children 5 to 14 years old. Infants less than 1 year old had a higher rate than adults. People living in the West region had the highest occurrence, followed by the East and then the Alaskan regions. Although primary care providers and pediatricians can treat molluscum contagiosum, dermatologists, infectious disease specialists, and pathologists may be consulted for diagnosis and treatment. There are many home remedies that could help with treating this: apple cider vinegar, tea tree oil, alcohol, iodine, hydrogen peroxide, and elderberry extract.